Okay, so we have also here the sediment examination technique. Okay, so basically when we are identifying the sediments here under the microscope, we are identifying that one in unstained state. Pag sinabing unstained, so most likely our sediments appearing to be colorless, almost colorless under the microscope. And it might eventually would have some difficulty in identifying them if they are in unstained preparation. And sometimes you can also stain our sediments here by different stain. Pero pag sinabing stained ang ating smear here, so ginagawa natin ay kailangan muna nating concentrate ang ating sediment by cytocentrifugation or even by centrifugation. And after that one, gagawa tayo ng smear, kukuha ka ng sediment. After decantation, you put it one in a slide, then air dry. Okay, and then try to stain. Hindi tayo mag-stain na nasa wet mount preparation tayo. Do dapat naka-dry siya. After that one, that's the only time you're going to stain. Okay, so pag na-stain, so eventually your sediments here were able to be colored. Pag nagkakaroon siya ng color, it would help you then to identify those sediments. It will be easy for you to identify them under the microscope. So the first one na stain, we have your Sternheimer-Malvin stain. Your Sternheimer-Malvin stain, combination of your safranin O and your crystal violet. So this would help differentiate between your WBC, your epithelial cells, and your CAS. Then we have also here your supervisor stain, your 0.5% toluidine blue. That would help here differentiate between your WBC and your RTE. Then we have your 2% acetic acid that would help identify our red cells. Okay, so upon addition of your 2% acetic acid, it would lyse the red blood cells but not the other cellular sediments. It would also allows the identification of your nuclear details of your WBC. So pag nag-add tayo ng acetic acid, okay, magle-lyse ang ating red cells. Pag nag-lyse siya, mawawala sila. And then, if you have your WBC, magiging very prominent ang kanilang nucleus. Parang nagagalit siya. Kitang-kita if you are adding here your acetic acid. So, ginagamit natin ang acetic acid if you are having a confusion kung ang nakikita ba natin under the microscope ng mga bilog-bilog ay RBC ba siya? Is that a WBC? Is that your yeast cells? Is that your oil droplets? Is that your air bubbles? So, mag-a-add tayo ng acetic acid. Pag nakita mo may mga bilog-bilog tapos nag-add ka ng acetic acid, then after that one, nawala ang mga bilog-bilog, so those are your RBC. Pero pag after addition of your acetic acid, andun pa din yung mga bilog-bilog na nako-confuse ka kung yan by RBC or hindi. Andun pa rin sila, so hindi yun RBC kasi hindi sila nagle-lyse. Okay, ang acetic acid, it would lyse your RBC. Another one, we have also here your lipid stain in the form of your Sudan 3 and oil red O for identification of your lipids. In the form of your triglycerides and your neutral fats, they are stained, producing here red-orange droplets. But in the case of your cholesterol, cholesterol will not be stained by your oil red O and Sudan 3, but your cholesterol is capable of polarization. It's capable of Maltese cross formation. Another one, we have your Hansel stain, which is made up of your methylene blue and your eosine Y for identification of your eosinophils in the case of your allergic reaction caused here by drug administration. You call this one your drug-induced interstitial nephritis. Then gram stain for identification of your bacteria. So, ang bacteria natin would resemble your amorphous substance, like in the case of your, or even your granular, mga granules natin. So, if you're using the gram stain, pag bacteria ang present, they will be stained. But in the case of your, for example, your granular CAS, nako-confuse ka, for example, is that a bacterial CAS? Is that a granular CAS? So, gagamitan mo siya ng gram stain. Pag nag-stain siya, mean to say that one is your bacterial CAS. Pag hindi siya na-stain, that's your granular CAS. Kasi your granular CAS, saka bacterial CAS natin, medyo pareho ang kanilang itsura under the microscope. So, pag na-confuse tayo, then gram stain gagamitin natin. Pag na-stain siya, that's your bacterial cast. Pag hindi siya na-stain, that's your granular cast. Okay, another stain, we have your Prussian blue stain for identification of your hemosiderin granules. Hemosiderin granules is your iron granules. It came from your red cells na nag-rupture or nag-lyse. Okay, and in the case of your hemoglobinuria, it will be stained blue for your hemosiderin granules, for the Prussian blue staining. Okay, now we go to the different sediments, constituents present in your urine sample. Okay, so normal values here for the RBC, it is 0 to 2 to 0 to 3 per HPF. Okay, pag more than that, so significant na ang ating RBC. In the case of your WBC, it is 0 to 5 to 0 to 8 per HPF. That's average number per 10 consecutive fill, diba? So kanina. And highland gas 0 to 2 per HPF. Again, more than that, we consider as one as already as significant. So we start the discussion with the RBC. Okay, the RBC is medyo mahirap siya i-identify under the microscope, especially for inexperience. Kasi iba-ibang shape ng ating red blood cells. At the same time, wala siyang nucleus. Okay, so we have that in a concentrated hyperstenoric na urine sample, the RBC would become crenated. In the case of your dilute hypostenoric urine, okay, try to absorb the water, it try to swell, and eventually ruptures, and try to release the hemoglobin. Pag nawala siya ng hemoglobin, become here ghost cell. Pag ghost cells here, okay, those are the red cells na nawala ang kanilang hemoglobin. So, medyo mahirap siya identify. Usually, parang ganito lang siya. Okay, wala kang makikita sa loob. So, parang meron na siyang indentation here that would identify that one's your red cells. And since medyo wala siyang hemoglobin content, your ghost cells here would be difficult to identify. That's why pag nakakita ka ng ganyan, so most likely dapat it's being recommended that you try to reduce the light para makita mo ang mga ghost cells. Pag sobrang liwanag ang light natin, he could not identify that. Okay, then we have here increased red blood cells could be found here in the case of your glomerular bleeding, where what you have here is this morphic na RBC. This morphic red blood cells would have here fragmented na may protrusions. Okay, another one, increase ang RBC natin in the case of your strenuous exercise. Renal calculi is your kidney stone, and you could also have here non-pathologic naman menstruation sa mga female na patient. Pero pag patient natin is not a female, so okay, rule out natin menstruation. So, it's not normal for the male patient na may RBC kasi diba, hindi naman sila nagme-menstruation. So, it might be meron siyang bato, kidney stone, or might have here glomerular bleeding related to your renal calculi.